News of the spread of the new variant of concern of COVID is something which concerns obviously people not just in India but around the world. Since we've all been vaccinated by and large, the impact of this may not be very, very severe, but the spread of this new variant is perhaps something that we should all be alerted to, because getting COVID, even if it is mild, is not a pleasant experience at all. But what do we know about this particular strain and the danger that it poses, if at all? Joining us now, Dr. Rajeev Jayadevan, co-chairperson of the National Indian Medical Association COVID Task Force. Thanks very much, Dr. Jayadevan, for being with us. I was going through a couple of tweets of yours, and you seem to indicate that in the Kochi area, the rate of positivity was incredibly high. What is it right now as per your calculations?
Yes, over the past month or so, the number of COVID cases has been creeping up. But as you know, testing in our country is quite low, close to zero in many places for many reasons. People are not keen to test, and doctors do not order the test either. And I don't find a problem with that. But if you look at the statistics, as I posted on the graph from September, October, November, and December, there is a sharp uptick sometime in November. Before November, it was only around 1% of influenza-like illness showing positive for COVID, which is practically zero. But from November onwards, we've had about 9%. And in December, after the meeting that concluded last night, it was 30%, 30%. And these data from multiple hospitals in the region. So this shows that COVID is taking a greater share of what we call influenza-like illness, which basically means respiratory problems, breathing trouble, cough, fever, body ache, that sort of thing. So we know from INSACOG's database that this JN.1 has been detected in India as well. I think it shows about 20 sequences from Goa, one each from Maharashtra and one from Kerala. Now, JN.1 is rising all around the world. It's considered the fastest rising variant at this time. Now, fastest rising does not necessarily mean more cases. It simply means it's dominating the landscape, the COVID landscape. So the cases are increasing, but most of them are being able to treat at home. Primarily because right now, as it starts, most people who are getting infected are people in reasonably good health, younger individuals who are mobile, attend social events, or go to work, or go to classes. So as it spreads to the older and more vulnerable people, we have to keep a close watch on how they respond to this infection.
I just want to go back to this graph of yours. Are you suggesting that as per the latest data, 30% of all those being tested for influenza are turning out to be COVID positive in the Kochi area?
Yes.
Is that interpretation correct? So this graph of yours is limited to the Kochi area?
Yes.
Right.
Yes.
I ask this because, even in the past, Kerala has led the country when it comes to reporting COVID and testing and things like that. It highlights a working system of health in many regards in that state. Is it your fear now that this is becoming a community-wide spread of this variant of COVID?
It is very much in the community. My neighbor has tested positive just today evening, so it's everywhere. So, but like we saw with the Delta variant in 2021, it's not causing a huge surge in hospitalization. So that's the difference. So in real life, when if I'm not a doctor, if I get a fever and a cough, I'm not going to go and test for COVID, am I? So that is the reality over here. So it might pass off as a mild case of a flu or even a common cold in most instances.
And what are the symptoms?
The symptoms are sore throat, body ache, fever, and a little bit of cough, runny nose. Some people lose sense of smell and taste, but that's a minority. Some people go on to get sinusitis, which is typically bacterial in origin and may require antibiotics.
Doctor, in as much as you make the very important point that this is unlikely to progress into something serious, it does remain a cause of concern for those with comorbidities, as always with COVID, right?
True. There are many individuals, not necessarily who are older, who live with multiple disease conditions that are stable enough for them to get on with their life at home on medication. But the slightest upset can upset the balance, like a viral infection, whether it's COVID or otherwise, and this could push a few of these people into hospital. All of them are being discharged in good condition as I speak. Deaths are directly from COVID are in our realm of understanding so rare at this time. But as I said, in the absence of widespread testing, it's really hard to give a more accurate picture than I have given now.
Doctor, it's been a while now since we've got our booster dose. But from your understanding, does that truth continue to remain that if you've been vaccinated and boosted, then chances of progression to serious disease is minimized?
That's the view I share with many other doctors in this field. From India's perspective, India is a well-vaccinated country. We use different vaccines than are used in the Western nations. We must remember that. So their data might not be applicable to India at this time. But from experience from prior waves of COVID, we can say that since the vaccination came in and was widespread, and since Omicron came in and infected a very large number of people in our country, the number of severe instances of COVID are few and far in between. If you ask professors of infectious disease in renowned medical colleges, they'll say the last COVID death they saw was a year ago. So it tells us that perhaps the vaccines may have kept this thing away for a long time. So the concern occurs when a markedly different variant arrives. For example, JN.1, it is not like a one-step ahead variant. This is a multi-step ahead variant. We call it a saltation event in genetics, which basically means a pile of mutations suddenly occurring at one go. So that caused a bit of concern in the second half of the year about what this variant could do. But it really did not. Its ancestors really remain very docile. JN.1 is basically 2.86.1.1, basically 2.86 with one additional spike mutation. In plain English, it means a slightly altered version of BA 2.86, which suddenly has taken off and displaced all other existing variants. So that is a summary of COVID at this time.
Dr. Jayadevan, let me ask you that dreaded question. Is it time to start masking up?
I would say if you are trapped in a situation where it's ill-ventilated, closed, crowded, you feel the air is stale and there are people around you, it is safer to mask. If you're traveling in a vehicle with multiple people who you don't know, which commonly happens if you share a ride, wear a mask or at least roll your windows down. If you're traveling in an elevator that stops at multiple floors in a tall building, wear a mask because it's a closed space occupied by many people. And some of them could be having symptomless COVID or even influenza. Influenza is also a major player this season. So masks, when you walk on the road or relaxing on the beach, there's really no need to wear a mask, obviously. But my point is that it must be done in a fashion where it's like when you ride a motorcycle, you wear a helmet, but you don't wear it inside your office. Something like that. I think people get the idea.
So do you believe that there needs to be a mask mandate? I understand what you stated right now, that it's not always required, but a mask mandate, for example, in workplaces. If you have entire offices falling ill, right, then it doesn't help anybody. So we had, for example, as journalists, we kept working throughout COVID. Our office never shut, never missed a day of work. But that's because we had masks on all the time. Are we getting to that stage, or is that, on my part, a bit of an exaggeration?
Personally, I'm against all mandates. That's just my personal viewpoint. Personally, I think a clear instruction to the public about when to wear masks and when not to will be more helpful than asking everyone to mask up, which clearly will not win any favors in when we communicate. So the way we communicate is we tell people who are in high-risk situations or people who are living with others who are frail or older or immunosuppressed. Yes, they should wear masks more than other people. So I think I wouldn't bring a mandate into discussion at all at this point, if you ask me.
Just one or two questions, Doctor. If it's 30% of all cases being tested in Kochi, and these are, of course, as you mentioned, a very small number of people who are actually testing, it would be probably accurate. Would you agree that it's now spread across the country? People fly, people travel, people go on trains, etc., etc., etc. It just so happens, and this is exactly what happened last time around, that we got numbers first from Kerala. Would it be fair to assume that the community spread that you speak about is likely to happen across large parts of our country?
Yeah, India is a very large geographical region, so it's unrealistic to expect a uniform spread in our country. Typically, COVID spreads in high travel zones, which are travel hubs. Kerala is a travel hub, so is Maharashtra, Mumbai area, Goa is a travel hub. We got 18 sequences of JN.1 from Goa. So I would imagine it will spread in these zones first and then slowly trickle into the other areas as people travel more and more. Because it's been a 7-month gap since the last wave occurred in April, but that wave, as I mentioned, did not overwhelm our systems. So I would imagine the spread will continue to be stochastic in nature. In plain English, it basically means it's like mold spreading on a slice of bread. It doesn't appear on all parts of the slice at once. It starts in one area and then gradually spreads to the other area. India being such a large area, that is likely the pattern of spread that we're going to see. But it's unlikely we'll see it because in many places testing will not be done.
All right. Well, Dr. Jayadevan, thank you very much for speaking to us once again, educating our public on what remains a persistent health concern. Unfortunately, that's what COVID has become. It's never going to go away, and we just need to keep fighting it as we've done in the past. Thank you very much, sir, for being with us.
Thank you.